So good evening, class. For our lecture 8, this is all about fixation. Basically, this is the first step in your histopathologic process. No, so fixation basically again is the first and as well the most critical step in histotechnology. This is a process by which the constituents of cells are, and as well the tissues are fixed in a physical and chemical state. So this preserves your tissue by stopping all cellular activities so that the cells can be viewed like in their original living state. So basically this prevents autolysis, no, by inactivating the lysosomal enzymes. So in the previous meeting, you differentiate autolysis and putrefaction. Your autolysis basically involves your hydrolytic enzymes as well as your lysosomal enzymes, while your putrefaction, basically this is the decomposition of the organic matter, no, with the participation of the microorganisms. So we have two purpose for fixation. Actually, the primary, no, purpose of fixation is to preserve the morphological and chemical integrity of the cell, again, in a lifelike manner. No? As you compare to the secondary purpose, which is to harden and protect the tissue from trauma of further handling. So basically, this is for the tissue to be easier to cut and mas gahi siya, mas easier ninyo i-process after, no? As we go on with the cross examination. So effects of fixative, basically it hardens your tissue that would lead to resistance to damage and distortion during your next step of process. Also, they act as a mordant or accentuators for certain stains. And they increases optical differentiation of tissue. They render insensitive, they render cells insensitive to chemicals. They prevent again putrefaction or bacterial decomposition, and they minimize the risk of infection during handling and processing. So you have two mechanisms in fixation. First is denaturation. This is the common effects of your dehydrants, which are your alcohols and your acetones. Um, this works through removal and replacement of the free water in tissues. No, that would lead to change in the tertiary structure of your proteins through destabilization of the hydrophobic and hydrophilic bond that will ultimately result to insoluble proteins. The second mechanism is the addition and cross-linking formation. So these fixing agents would chemically bind to the proteins and other components by addition of inter and intramolecular cross-link. So these are your cross-linking, this one. So basically for your electron microscope, glutaraldehyde is more effective than formaldehyde, basically because of the cross-linking formation. No, they preserve the ultrastructure of cells. So your glutaraldehyde basically is a fixative of choice for your electron microscope. Your formaldehyde basically would stain poorly with eosin because they react with amino acid forming methionine bridges, which basically renders them or will not enable them to bind na with a negatively charged dye as for example is your eosin. Usually the fixative of choice, no, most common is a 10% neutral buffered formalin. So we have here the factors affecting the fixation. First is the pH and the buffer. So for light microscope, the pH does not affect tissue preservation. However, for your electron microscope, um, pH should match physiological pH, no? Satisfactory pH occurs between your 6 to 8, and the pH of your formalin is 6.8 to 7.2. So basically, if ang low ang pH sa inyong formalin, it would result to a dark pigment that would basically obscure, no, your cellular detail. Another is the osmolality. So basically, you have learned siguro na this on other medical technology subjects that whenever there's hypertonic solution, so this is more concentrated, no, outside the environment sa cell. So therefore, pulling out the water from the cell that would lead to cell shrinkage. For your isotonic and hypotonic solutions, of course, increase ang sodium sa sulod sa cell. So where sodium goes, water follows. Therefore, it would lead to swelling and of course, poor fixation. So what is best, no, for our histopath fixation is the slightly hypertonic solution between 400 to 450 milliosmoles. Another is temperature. So traditional or usual is room temperature between 80 to 45 degrees Celsius. If you're using electron microscope, the ideal temperature should be 0 to 4 degrees Celsius. Remember that when there is an increased temperature during fixation, it would increase the fixation rate and it would increase the chances of autolysis. For specimen size, the cassette size is 3 by 2.5 by 0.4 centimeters. The thickness, our ideal is 3 millimeters and it should be not more than 0.4 centimeters for your light microscope. For the size, ideal for light microscope is 2 centimeters squared. What for your electron microscope, it should be 1 to 2 millimeters squared. For the volume, what is recommended is that 1:10 ang ratio sa ato ang specimen and sa atong fixative, but 1:15 to 20 is also allowable in other sources. For the time, um, it must be done, fixation must be done, no, ideally between 20 to 30 minutes after cutting off blood supply. And fixation usual time is 6 to 48 hours. Depending no, sa organs and sa tissues na itong gina-fix. For fibrous organs, you like your uterus and your intestinal tract, they take longer time to be fixed as compared to the small and loosely textured scrapings like of that with your prostatic scrapings. So fixation is retarded by size and thickness of the tissue. So the bigger, the thicker, no, mas dugay siya i-fix. Presence of mucus because it prevents the complete penetration of your fixative. Blood, pwede din, but you can address that by flushing with saline. And also fats, no? It can retard your fixation. It can be hastened by the size and thickness. Of course, the smaller, the thinner, it is faster to fix. Of course, heat is also one example of your mechanical fixation. So heat, no, at the temperature of 37 to 56 degrees Celsius, agitation and vacuum. Penetration rate, for the penetration rate of your 10% neutral buffered formalin into a 25 millimeter cube of the liver. So at 1 hour, approximately 0.8 millimeter penetration. At 2 hours, 1.2. At 4 hours, 1.6. And at 8 hours, 2.2 millimeters penetration on niya. So basically, after 8 hours, your center of your liver cube is not yet fixed because 25 millimeter man siya, 2.2 millimeters penetration man siya at 8 hours. So formalin daw, the penetration rate is 3.6 millimeter per hour and 7.2 millimeters at 4 hours, no? Basically, the temperature as 25 degrees Celsius and with a pH of 7. So this is considered to be the fastest. So we have classification of your fixative. It could be coagulant, non-coagulant, additive, and non-additive. For coagulant, this would result to a permeable meshwork of protein strands. They coagulate. Non-coagulant fixatives, they form extensive cross-linking, producing a less permeable gel. For additive, basically this chemically binds no to the uh, to the tissue, to the structures in the tissue, cellular structures inside your tissue. While your non-additive, basically they do not bind. However, they dissociate water from tissue protein groups. Types of fixative based on composition, you have two, simple and compound. Simple from the word itself, it has only one component substance. So for example, your aldehyde, you have your formaldehyde, you also have your glutaraldehyde. For metallic, there is some mercury chloride, chromate fixatives, lead fixatives, and your heat. For compound, you have two or more fixative. No? So type of fixative base action. So you have your microanatomical, which should allow the microscopic study of structures without altering the structural pattern and intercellular relationship of tissue. An example of which is your 10% formal saline, 10% neutrally buffered formalin, and your Zenker solution. But when you say um, cytological, this preserves specific parts of the cell. This could be nuclear fixative or your cytoplasmic fixative. Example of your nuclear fixative, you have your glacial acetic acid, which is the primary component. Basically, it has a good affinity with your nuclear chromatin. So the pH should be 4.6 or less. And ethanol is the most usable DNA fragments if it is for the PCR. Another example is your Fleming's and Bowens. Cytoplasmic fixative, basically this must never contain your what? Glacial acetic acid, which basically would destroy your mitochondria and I think Golgi. Next is your histochemical fixative, another type of fixative based on its action. This preserves the chemical constituents of cells and tissues. For example, if you want to fix a lipid, usually lipids are removed mango during the first process no over tissue process tissue preparation. So basically lipid fixation dapat i-cryostat or i-frozen biopsy sila. No, so with the addition of mercury chloride and potassium dichromate, which are basically useful for preserving your lipids. Your carbohydrates, you can use your alcoholic fixative or alcohol fixative. For protein, you can use your formaldehyde and NBF, now your buffered formalin, neutral buffered formalin. For glycogen, you can use your Rossman's fluid, especially when you want to diagnose glycogen storage diseases. So, types of fixative based on the active component. First is your aldehyde, very common si formaldehyde or si formalin. So this is a non-coagulant additive fixative with a water soluble gas of 37 to 40 degrees Celsius percent weight over volume, no? So basically your formalin reacts with your amino acid forming methylene bridges and it preserves peptides of cellular proteins. Advantage, it is best for your nervous tissue. It does not overharden the tissues. It does not require washing out unless prolonged affixation. While the disadvantage of your formalin is it becomes acidic upon storage. No, hence it would form formic acid. Paraformaldehyde would form white precipitates that leads to turbidity, no, and difficult na ang pag-assess ano. Formation of acid formaldehyde hematin, which is the brown-black crystalline precipitates. So how would you prevent that? Um, sa precautions sa inyong Gregorios, makita siya. So if there is a prolonged fixation with your formalin to result to bleaching, dispersal of fat, dissolution of glycogen, sodium crystal, and urine. So precaution, it was all stated in your Gregorius, no? Bleaching is prevented by changing it every 3 months. Restoration of the natural tissue color by immersing to 70% alcohol with fixation. You should add cobalt salts or your cadmium, which is or which will prevent the dispersal of fat. You can also add 10 to 14% methanol to remove paraformaldehyde precipitates, and also saturated alcoholic picric acid for 20 minutes so that or 1% potassium hydroxide and 80% alcohol to remove the black and brown precipitates. So I will cut the lecture. I'll just send you another lecture video.